Dependability, honesty, passion, determination, education, and the ability to learn. All of these words are qualities that employers look for in their future employees, and they are very important qualities. Today, my only goal is to show you why I would be an excellent diagnostic medical sonographer to add to your radiology team. But first, let's begin with the basics, my education and experience. Although I am only recently graduated, I did graduate as salutatorian of the class with an overall 4.0 GPA for the full 2 years. I attained status as a registered diagnostic medical sonographer and became certified in 2 of the 3 main certifications for an ultrasound technician before I'd even graduated. I recently have attained the 3rd and am now registered in abdomen, OBGYN, and vascular. I've had 6 months of experience outside of the 2 years of clinicals that I have done and have been working at Habersham Medical Center in Habersham, Georgia. I have experience in both first and second shift and am consistently relied on to take weeks of call at a time. I have already had to make plenty of hard decisions while working at the hospital. For example, we had a young female patient come in with the symptoms of a possible pregnancy loss, and I was doing her ultrasound. While I was scanning, I noticed that there was no intrauterine pregnancy, which means a pregnancy inside of the uterus, and saw signs for a possible ectopic pregnancy, which is a pregnancy outside of the uterus. Using my clinical experience and all of my knowledge from school, I had to make the decision whether I thought that this was an intrauterine pregnancy or an ectopic pregnancy. I ended up making the decision that it was an ectopic. I filled out my worksheet to reflect that, and then she was taken to surgery. I am also a team player. Often on second shift, there will not be a lot of ultrasounds. We may get 1 a night, we could get up to 6 a night. It just depends on the ER. So often, instead of waiting for one to come in, I go help the CT and X-ray techs, pushing patients, transporting patients, filling out and scanning their paperwork, and often prepping patients for their exams. Also, it turns out, being a night shift, that it's often only 3 of us in there that have to decide how to move a bedridden patient, which can be quite difficult. But we work together and communicate as a team to effectively move the patient so that they are exactly where we need them, and it causes as little discomfort to the patient as possible. And my last point, my determination, dependability, and ability to learn. I have been known most of my life for being the most determined person in my family. If I want to do something, I figure out a way to do it and get it done right. This also translates to my ability to learn and to keep learning as I go on through the field. I know that I don't know everything, especially with only 6 months of experience. But I know that I have the ability to learn on my feet and learn very, very quickly whatever I need to do. I'm also very dependable. In my entire education and scholastic career, I have never once missed a day of school, and my teachers have often been known to laughingly call me annoyingly early. And last, but certainly not least, I am very honest. I don't lie, use subterfuge, and I definitely don't get mixed up in workplace drama. I just do my job to the best of my ability and give the best patient care that I can. In closing, I know you will pick whoever works best for you and your company, as you should. I am only here to show you that I could be a potentially excellent addition to your radiology team and then leave it to your discretion. I appreciate you watching and hope you have a wonderful day.